Gonorrhea is a sexually transmitted disease. What is gonorrhea? Gonorrhea is caused by Neisseria gonorrhea, a bacterium that can grow and multiply easily in the warm, moist areas of the reproductive tract, including the opening to the womb, and the egg canals, also in the urine canal for both men and women. This bacterium can also grow in the mouth, throat, eyes, and anus. Gonorrhea is also termed the clap, and untreated gonorrhea is the leading cause for several diseases in people that are linked to later diseases. These include pelvic inflammatory disease, scarring of the fallopian tubes, ectopic pregnancy, and endometriosis. How common is gonorrhea? Gonorrhea is a very common infectious disease. Doctors estimate that more than 700,000 people in the United States get gonorrhea infections each year. Less than half of these infections are reported to doctors. In 2009, 301,174 cases of gonorrhea were reported to doctors. Any sexually active person can be infected with gonorrhea. In the United States, the highest reported rates of infection are among sexually active teenagers, young adults, and African Americans. How do people get gonorrhea? Gonorrhea is spread through contact with the penis, vagina, mouth, or anus. Ejaculation does not have to happen for gonorrhea to be transferred. Gonorrhea can also be carried from mother to her baby during delivery. People who have had gonorrhea and received treatment may get infected again if they have sexual contact with a person infected with gonorrhea. Signs and symptoms of gonorrhea. Men and women have different signs and symptoms when having gonorrhea. Men may not have any symptoms at all, but the women's symptoms are usually mild. However, when some men have symptoms, they appear 1 to 14 days after the infection has started. Some symptoms and signs are burning when urinating, or a white, yellow, green discharge from the penis. Sometimes men with gonorrhea get painful and swollen testicles. Some symptoms for women are burning while urinating, increase of vaginal discharge, or vaginal bleeding between periods. Symptoms of rectal infection in both men and women may include discharge, anal itching, soreness, bleeding, or painful bowel movements. Infections in the throat may cause a sore throat, but usually causes no symptoms. How is gonorrhea diagnosed? Tons of laboratory tests are available to diagnose gonorrhea. A doctor or nurse can obtain a sample testing from the parts of the body likely to be infected, cervix, urethra, rectum, or throat, and send the sample to a laboratory for analysis. Gonorrhea that is present in the cervix or urethra can be diagnosed in the laboratory by testing the urine sample. What is the treatment for gonorrhea? Antibiotics can successfully cure gonorrhea in adolescents and adults. It is important to take all of the medication prescribed to you to cure gonorrhea. Even though medication will stop the infection, it will not repair any permanent damage done by the disease. People who have had gonorrhea and have taken medication to get rid of it have chances of getting it again if they have sexual contact with people infected with gonorrhea. If a person's infection symptoms still remain after the treatment, they should go to a doctor to be re-evaluated.